So prior to summer 2012, and I know we reviewed this before, there was collaborative work ongoing with CDC, USDA, National Pork Board to develop a pilot swine influenza surveillance program. And that was sort of in the works when the 2009 pandemic hit, but what happened was that really accelerated the surveillance program implementation. So as probably most of you know, this is a voluntary program and anonymous. It can also be traceable, but when samples are submitted, they can be submitted by the veterinarian as anonymous samples or traceable, and they're asked for that, and the veterinarian will indicate that on the form. The objectives of the program are really to get an idea, so this gets a sampling of what's happening out there so that we can look at the genetic evolution over time in the swine herd and the ecology of the virus. And we can use those isolates, the virus isolates, for research activities. And we can also use the isolates for development of diagnostic assays, reagents, and vaccines. And that's an area that we're really starting to focus on now, is the diagnostics and vaccines, having now had a couple years of having those samples come into the program. It also provides a public health link, which allows them, through accessing the sequences or submitted into GenBank, further research, to sensitize the human health surveillance network in the state, and then it makes that collaboration with animal health to make sure we have that coordinated risk communication, and we know how important that is when we have outbreaks, to make sure we all know what's going on and communicate in a coordinated manner. There's 3 different surveillance streams. One is case-compatible accessions, so those are when you have a clinically ill animal and they're submitted by the veterinarian to the diagnostic laboratory. If we have a first point of contact, so something like a state fair or a fair would be a commingling event, and any case in which swine is linked to a human case, the swine influenza virus would go into the system. Once the results are reported they go to the National Animal Health Laboratory Network, so one of the diagnostic labs. Then they're reported to the USD surveillance unit, and an isolate is placed within the repository. Once these are sequenced, they're then placed into GenBank. So that's publicly available. Anyone can go in and look at those sequences and monitor them for interest, including public health. Currently, we have 37 non-labs that are testing swine samples for influenza virus. And for fiscal year 2011 and 12, we had more than 4,400 accessions. So an accession basically being a sample. This is some information on the data surveillance provided by John Korslin. As you can see, this is sort of when we started out, October 2009, and these are our accessions or our samples. So we started to have an increase, and we're really seeing good submission into the program now. These are the ones that initially we had our positive accessions, and the laboratory is starting to catch up with being able to subtype those so we know what kind of subtypes are in there. So they've been doing a really good job over the past year of looking deeper into those with subtyping and sequencing. This just breaks it down a little bit more. Unfortunately, these colors are a little bit different. This is courtesy of Dave Pyburn, but it just gives an idea of the different subtypes that they're collecting, what percentage of each. And here it just gives it over time. So you can see last year, so August 2012, this would be your H3 N2 when we had some of those submissions from the fairs coming in. And again, this just shows the same breakdown of subtypes, that rather than on a 100% scale, it shows the number that are being submitted. So you can see during August 2012, we had a peak here, and then we have sort of our seasonal influenza and submissions from clinically ill animals into the system. So we've had very good continued producer participation in this. And this information is all available from the NON website, and they provide a quarterly update on the samples that are being submitted. When the program was implemented, the pork industry did an outreach, sending a brochure and newsletters to all of their producers, as well as the American Association of Swine Veterinarians, and that's available on both our websites. So now I'll just turn to the current and future focus of influenza, having given a brief overview of where we began and where we are now. As you know, this year we had a series of events concerning H3N2 variant virus. So these were human cases that were reported by the Centers for Disease Control. Prior to 2012, or the summer of 2012 through 2011, we saw 12 residents affected with this virus. So this is something that's not uncommon. We sporadically see movements of influenza virus between humans and animals in humans. And in April 2012, we did have a detection in a child. But it was really from July to September 2012 that we saw an increase in the number of cases, 307 across 11 states in total during this time. And these were mostly associated with exhibitors, so children that were in contact with the pigs at agricultural fairs. Now the USDA also went back through their system and first identified this strain collected in swine in late 2010, and from October 2011 to July 2012, so sort of when this began occurring, 57 cases to date were positive for this strain. So they had seen a little bit of this in the system, and I think, again, this demonstrates the value of the surveillance system to see what's happening and potentially, as we look and get better at looking into this, what may be viruses of interest that may have a potential transmission between humans and animals. Now, what did this all mean? Well, at the time, there was concern or attention by public health officials that this virus was more transmissible from pigs to humans than other influenza viruses. There was also concern that because we know influenza viruses are changing, that it would begin to spread more easily from person to person. This we did not see in this case. We didn't see any sustained ongoing human-to-human transmission. And when the CDC did studies, they identified that children less than 10 years had less immunity or little immunity to this virus versus those that were older that had some pre-existing immunity. So they were a potential risk group, and this raised the public health concern. In terms of the National Pork Board response, this experience was different than the 2009. The show pig population, as we know, is inherently different, and I think we all learned a lot about the show pig population that we didn't know, and probably there's still a lot to learn in the movement of animals and that. So it's been a good education for everybody. The risk factors are different, but the control measures can be very similar in terms of biosecurity, and we'll get a little more into that, and I think Dr. Marsh will talk more about that with the recommendations or measures. When this initially began, we reactivated our crisis management team, which is just our internal team to prioritize response, and also worked very closely with a number of stakeholders on information needs and messaging. So there was a lot of requests at the beginning as to what was happening, updated information, educational brochures, and we worked a lot on getting that material out as quickly as possible to our audiences. And that included also our international partners, as well as the state vets, the state public health vets, and the fairs. We worked on a couple different materials, and as did a number of other people, but I think we had a good collection of those. Tips to keep your pigs healthy at the fair, so focusing on biosecurity as well as how to keep yourself healthy. And we also focused on putting out a document on influenza naming. And I think the value of that is that we know from the 2009 that there can be easily misinterpretations or public perception with naming and using terminology like swine flu. And so proactively, we had met with American Association of Swine Vets and CDC and NPBC and sat down with CDC in 2011 and talked about the impact and coordinated communication in terms of risk communication when these events happened. So just prior to this event this summer, what we saw was the international health agencies met to discuss influenza naming and announce a new naming convention. So this was basically standardizing the terminology of the virus naming. So when a virus that normally occurs in an animal host moves into a human, it's designated as a variant virus, which allows for a standardized naming and makes this a little bit clearer for media and public perception doesn't get off with using or misinterpreted by using other types of terminologies. And we just have a fact sheet that's available on our website as well, if you want to read that through. As well, Lisa Becton has a Champion's Guide to Youth Swine exhibition that we've had good response to. It's been a valuable a valuable document for swine exhibitors, and that's recently been updated this year, and I believe that will be posted on the website very shortly as well. There was also a lot of demand after these events, or a lot of requests as to what are we doing into the next fair season? What are we going to do to mitigate the risks and really better understand the risks? Because part of it is we just didn't understand why this happened in this case, in this scenario with exhibitors and their pigs. And so we held a influenza working group where we brought together the state public health vets, the state vets, the vets on exhibitions in a couple of key states, including Indiana, Ohio, Minnesota, and Iowa, and just spent a day talking about what might be some of those risk factors, what events occurred, what the responses were in the different states, and how that might have impacted the different disease scenarios in each state. And we were also looking at how this might relate to commercial production. Were there any similar risk factors that we wanted to look at or materials to put out to our commercial producers? And I think that was a really good discussion. It got us all talking and thinking about what the next steps would be. And that led to the Swine Exhibition Zoonotic Influenza Working Group and a set of best measures for swine exhibitions or for exhibitions. And I know Dr. Marsh will probably go into a lot more detail on that for you in the next lecture. With respect to committee activities, at the Pork Board, I have the pleasure of directing the Producer and Public Health Workplace Safety Committee, and we have a budget for research. We focus on various zoonotic diseases, which includes influenza, and this year our tactics included looking at interspecies transfer, current and new interventions for mitigating risk, and the epidemiology of the virus. And we have a few studies that we funded this year that are looking into that, including potential transmission between humans and pigs and humans in the commercial setting. As well, we're always engaged with managing emerging zoonotic diseases and public health challenges. So in summary, we know influenza is a common disease, but it has a potential human health impact as well as a potential animal health impact, movement back and forth between species, and something we want to keep in mind. Producers are interested in protecting both animal health and public health of their employees, their families, and their communities, and they continue to support research in this area, both the human and animal applications. As we'll see, and I know Lisa, if you have further questions on influenza as well, can talk about the surveillance program, but there's a continued focus on improving swine health and monitoring for influenza, and we're pleased with the submissions and encourage more submissions into that program, because surveillance can benefit both the animal health and the human health pieces. And continued engagement, we appreciate engaging with all our stakeholders on all aspects of influenza, how it relates to production and health.